Welcome back to wound healing. In this section, we're going to be talking about the second stage of wound healing, which is when inflammation occurs. And so this actually starts at the same time hemostasis is going on because the injured blood vessels are going to be leaking plasma. So now we have water and salts and proteins and all kinds of things in the local tissue, causing some swelling, which will help control bleeding and help wash out bacteria that may have come into the wound. When we're looking at the inflammatory stage of wound healing, we're going to divide it into an early response and a late response. When we learned about inflammation earlier, we learned that the inflammatory process in a normal, competent adult will take about 7 to 10 days. And so the inflammatory stage of wound healing will typically last 1 to 2 weeks, but because wounds can be various sizes and patients, we take them as they are, and a lot of patients will have other systemic processes going on. This simple stage of inflammation can take 4 months to resolve in a wound. So let's talk about this early inflammatory response. I'm going to put my glasses on so I can see the colors of all the different things there in that picture because I'm going to be referring to the picture. So as I alluded to before, we're going to have leaky fluid coming out of the blood vessel. Well, what caused that? Well, the tissue damage, for instance, to mast cells, called mast cells, to release mediators like histamine, and leukotrienes, and that's going to cause a localized vasodilation. And so the endothelial cells of the capillary are going to have little spaces and all kinds of stuff can leak through. So you can have that increased capillary permeability. And so coming through, not only with the plasma, we are going to have neutrophils. Our first responders are going to respond. They're going to undergo diapedesis in those little spaces, and now they're in the tissue. And so, of course, one of the first things those neutrophils are going to do is they're going to make a beeline to the bacteria that shouldn't be there, and you start engulfing them one by one, and the granules inside them will be killing them. Or they can release granules externally and create a little killing zone. They're also going to be releasing proteases, which are going to help break down the damaged tissue there. So now we're going to have a whole bunch of chemokines or cytokines, we're going to have a lot of chemotactic factors being released. And so we're going to be recruiting a lot more neutrophils. And so now, for the first day or so, we just have a party full of neutrophils who are going to be doing phagocytosis. So the neutrophils become macrophages. Okay. And so not only are they looking to phagocytose bacteria, but they're going to do phagocytosis of damaged tissue. And this process is called debridement, where we're getting rid of damaged tissues. And so the microscopic level is going to be happening from the macrophages. Okay. So at this point, when we look at the wound in early inflammation, we can see that it's swollen, it's warm, it's red, it can be painful. That's all related to all these chemical mediators that were released. And so remember, inflammation is part of normal wound healing. If we don't have the inflammatory phase, that's bad. If someone has a wound and a day later you look at it and there's no redness or swelling or heat, that tells you there is impaired blood flow to the injury site. And that's a big clue that the 4 stages of wound healing are going to, instead of being ba-ding, ba-dang, ba-dung and happening rapidly in succession, it is going to take a long time for that wound to heal. Okay, so moving on to the late inflammatory response. Well, late is a relative term. What it means is not the first day, and it's not the second day, it's day 3. Okay, so in day 3, now we're going to start not only having neutrophils show up, but we're going to have macrophages show up that have monocytes as their parents. So in other words, monocytes are going to undergo diapedesis, and they're going to become the predominant cell in the tissue. And just like the neutrophils that do phagocytosis, the monocytes becoming macrophages are going to do phagocytosis. They're also going to secrete growth factors. You can see in this little box here, it's like a vascular endothelial growth factor. It's an epidermal growth factor, interleukin-1, which we know will call in other leukocytes to the area, tumor necrosis factor, and then another growth factor in there. And so the macrophages coming from monocytes do play a very important role in wound healing and fighting off infection. And guess what? They're going to be around for a lot more than just 3 days. And so this is interesting because histologically, we can look at a wound and tell if it's in the early inflammatory stage or a later inflammatory stage just by the fact of, is it 90% neutrophils? Or is it 10% neutrophils or less? So let's talk about the roles of neutrophils in the inflammatory phase. And I've got 4 little pictures here to take you step by step. So when a wound is injured, there are multiple reasons why neutrophils are going to undergo diapedesis. It's because they're getting all these calling cards, all these chemotactic things are happening. We're going to have waves of calcium being released in the tissue. We're going to have hydrogen peroxide. We're going to have these molecules called DAMP, which basically is an abbreviation for damage-associated molecular proteins. And we're going to have other chemotypes. And so all the damaged cells that were there are releasing these things right after being injured. And that is like attractive to the neutrophils, so they undergo diapedesis. And when the neutrophils go there, they're going to do something called netosis, which we haven't talked about before, but it's really cool. They're going to be releasing proteins, but then they're going to go to the site of injury and they produce these long structures. Their filaments coated with protease. So remember, protease is going to be breaking down protein structures. So there are these long filaments created with proteases. And basically, because we have so many neutrophils and we've got all these little things, they form this little web, which is going to be trapping damaged cells and trapping bacteria in there. And so then the neutrophils can use their granules with phagocytosis or by releasing the granules to be killing these things. So what's going to happen is this is really going to peak at about 48 hours after injury. And by 72 hours, remember, we have our friend, the monocyte, undergoing diapedesis, and they're forming large macrophages. And we are transitioning from the early phase to the later phase. And one thing that the macrophages from monocytes are going to do is they are going to be doing phagocytosis of neutrophils, which are still hanging around. And this is crucial for the resolution, for the stopping of the inflammatory phase. Now, some neutrophils will escape being eaten alive by macrophages by doing basically a reverse diapedesis, what's called a reverse migration, and they'll leave the wound by re-entering the local blood vessel. So that was the neutrophil. Let's review the role of the macrophage in the second inflammatory stage. So once the monocyte has left the blood vessel and become a tissue macrophage, it's going to be releasing cytokines which are pro-inflammatory, interleukin, tumor necrosis factor. They also release a monocyte chemotactic. In other words, they release something which is going to do a positive feedback to bring more monocytes to become macrophages locally in the tissue, so that you will have a robust macrophage response. As I mentioned before, the monocytes from the macrophages can do phagocytosis of the bacteria, just like the neutrophils can, but much more importantly, at the end of the inflammatory phase, they are going to be engulfing dying neutrophils or leftover neutrophils, and this is what marks the end of the inflammatory phase, okay? So yes, they're important for phagocytosis of bacteria and for dead and damaged cells, but they're also important for ending the inflammatory reaction. And so I hope to see you soon when we get to our third stage of wound healing. Thank you for all your work in learning this material.